Dear students, welcome to Bluepin Online. Shall we begin? Please use headset, pen and paper to take notes.
Here you go. Please let's know your feedback after class.
So today we are going to study about the thorax. So first we will look into thoracic wall. Okay, the wall of the thorax. So how it is, what are the layers, how you are able to see the things and all. Okay, so we'll study the structure, skin, fascia, muscle and bone. Okay, so as you know, what is the function of the basic thoracic wall? The main function, protection. Then second function, it will help for your mechanical function of breathing. Correct, no? So see the thoracic cage here. So how the thoracic cage is formed? Anteriorly sternum will be there. Laterally on either side the ribs will be there. And backside your vertebra is there. So together it is forming the thoracic cage. And outer and the inferior or superior and inferior portion or outer and inner portion, there is a hole open. Correct, no? That is the thoracic inlet. We'll come to that. So thoracic cage you understood. It's a bony part of the thoracic wall. It is made up of 12 pairs of the ribs and costal cartilage. See this bars of the cartilage which is helping the ribs to connect with the sternum. So these are the costal cartilage. You are getting?
Oh. Yes, ma'am.
Okay. Then in front sternum is also there. So backside thoracic, 12 thoracic vertebra. Okay. So just we'll go through the ribs. So what is ribs actually? It is the flat curved bones with a high resilience, right? So there are three types of ribs. We can divide it into true ribs, false ribs and floating ribs. So with your finger you can touch in your body just below your breast and a little down you will feel some ribs, that is 11th and 12th, that is the floating ribs. So the false is 8, 9, 10, true is 1st to 7th. Okay.
Okay, ma'am.
So what are the basic features of the typical rib? So head will be there. Then two articular facets will be there in the neck, and just below the head neck will be there. So this neck will be connecting the head with the body, and tubercle will be there. So the tubercle having two parts, articular and the non-articular part, and shaft, angle, costal, groove. So these are the basic features. So I'll show in the picture. See the typical ribs are 3 to 9. Rib number 3 to 9 is the typical rib. So here you can see this is the head. So it is having two articular surface. Did you see anterior and the posterior? After that small constrictor portion, that is the neck. And after that shaft having one tubercle. Then the bend of the shaft is the ankle. So this is the shaft of the rib. And this is the piece of cartilage which will be connecting your rib to the sternum. This is the costal cartilage. So inside below there is a groove, that is the costal groove. The inside surface is the internal surface and outside surface is the external surface. So these are the basic things of the typical rib. And typical means 3 to 9. Okay. So other ribs are atypical ribs. That means they have their own features. For example, the first rib, second rib, 10th rib, 11th and 12th, all these are the atypical ribs. So true ribs means the ribs are directly connected with the sternum. Okay. And false ribs means it is connected with the sternum, but it is not through the, not directly to the sternum. Yeah. False means they don't have any attachment with the sternum. Hope it is very clear. And atypical ribs, the first rib, it's a flat, very small, just below your clavicle, and it is having groove for the subclavian vessels passage, and there will be a tubercle, that is the scalene tubercle. So that's about the first rib. I'll show to the first rib. See, this is the first rib. Head is the, neck is the tubercle, and there is a groove, subclavian groove, through which subclavian vessels are passing. And here you can see the attachment of the muscle, anterior scalene muscle, serratus anterior muscle, middle scalene muscle. So this is about the first rib. Okay. Then is the atypical, next is the second rib. So it is also having one rough tuberosity. The serratus anterior muscle gets attached. And next is 10th rib. The peculiarity is all other features are same, but the head will be bearing only one facet. Usually for a typical rib, the head is bearing two facets, anterior and posterior. But if you are checking the 10th rib, which is having only one head. Okay. Even 11th and 12th also having one facet on the head, but there is no neck at a neck and the tubercle. Clear?
Yes, ma'am.
So this is the way you have to identify the rib. Then apart from that, see, usually we have 12 ribs, right? So in some percentage of people, like 1% of people, extra rib will be there. So if extra rib is there, it comes from the C7 vertebra. So what is the complication here? If the extra rib comes from the vertebra, C7 vertebra, it will cause some pressure. It will insert some pressure on the nerves and arteries, which is supplying the upper limb. So partial paralysis will be the clinical aspect. Okay.
Okay.
Then another clinical important thing, the common chest injuries are happening in the middle ribs. That means 5 to 10 ribs. Okay, so the 5 to 10 ribs always getting the injury, common chest injuries. So the ankle, I told you, while this bend, while the ribs coming, no, it forms a bend. So that bend is the angle. Actually, it is the weakest part of the rib. So there is a tenderness in that point, and it get fractured easily. Okay.
Mm.
So that's about your ribs. So I will conclude the ribs. Ribs are the flat curved bones. There are 12 in number. In some 1% of people having the extra rib. If extra rib is there, it comes from the C7 vertebra. Okay.
Yes.
And then it is divided into 3 true, false and floating ribs. Okay. And atypical ribs are, what are the atypical ribs? First, second, 10, 11, 12.
11, 10, 12.
Yeah. Then we'll move to the vertebra. So if you're taking any vertebra, what is the structure? Body will be there, vertebral arch will be there, and process will be there. See here, you can see the transverse process. So this is the basic structure. And next we'll move to the sternum. So as you know, the sternum is a vertically elongated bone which forms your anterior portion of the thoracic cage, and it having 3 parts, that is manubrium, body, and the siphisternum. See here, this is the manubrium of the sternum, this is the body of the sternum, and this is the siphisternum.
Okay, ma'am.
Okay, so this point is the sternal angle. What is sternal angle or Lewis angle? The junction between the manubrium and body forming an angle. That is the sternum angle or the Lewis of angle. Okay, so the manubrium, if you are taking, it's having some notches like a jugular notches, clavicular notches, costal notch. See here. So here you can see just for the costal notch. So the ribs are connecting with here. Okay, and here you can see the clavicular notch, clavicle, and the top you can see the jugular notch. So there are 3 types of notches are there in the manubrium, and it is forming a joint, that is the manubriosternal joint. It is a secondary fibrosternal joint. See that this is the sternal angle, this is the manubrium, jugular notch, clavicular notch, and costal notch. Clear?
Okay. Yes, ma'am.